So I was thinking about whether I should go into the details. Then I thought, as you've seen, there are a lot of people who are coming after me who will be speaking more specifically on issues related to sustainability and resource management. So I thought, what could I cover? I said I'd perhaps start with a global setting, because today we all think global, but we act local. So from that perspective, I'll start my presentation by thinking global. What are the different issues? Many of you will be familiar with many of the things that I'll be talking about, but I would like to give a little bit different perspective so that we can see what the challenges are. To start with, I talked about there's an alarm bell now, which we didn't have in the past. Why is that? You can see in the last 200 years, the population has gone up 7 times. Okay? And that itself is a factor which has pressure on the environment. The GDP, which we use to show our economic prowess, that has gone up by 10 times in the last 200 years. Energy consumption, along with the 2 population growth, because after all it's for human beings, and the GDP for the economic growth, we have started using much more energy in the last 200 years, again, 25 times more energy, particularly since the time we have discovered fossil fuels. The whole of history of fossil fuel is hardly 200 years. History of electricity is even less than that. And today we cannot think of life without electricity. Freshwater consumption, in the last 100 years, our consumption has gone up by almost 6 times, 5.6 times. So all these are showing, and you can see the growth is not linear. It's exponential in the last 100 years or so. If we continue in the same pattern, where do we reach in the end? Taking it further, another important thing, one is we have seen all these growth rates are linked with material extraction. In the last 45 years, after the Second World War, in the last 45 years, we have increased our use of resources from the nature, materials, by 3 times. Same way you can see the material productivity. On the green is showing the population growth. The blue is showing the economic productivity. And the last one shows our material productivity. So you see, everything is going up except for our material productivity. Similarly, the greenhouse gas emissions are going up. So many things are going up. Something which is going down is the material productivity. So we need to think about how to, just like we are looking at human productivity, we are looking at resources, economic productivity, we need to look at how do you increase the material productivity or the resource productivity. Okay? You can see on one case, there's a deficit. If you take this is the base case, we have a deficit of resources. That means we are living beyond our means. If I show it in a more schematic way, what are the driving forces behind the growth today? Human population, we're seeing migration to the cities, urbanization. We also see there is a problem of poverty and inequality. A very small percentage of the population hogging maximum amount of resources. Others don't have access to the resources. Deprivation in basic infrastructure. We see in some places we have very good infrastructure, in some places there is practically no infrastructure. So all these resource consumption, where is it going exactly? Last but not least, very important, the changes in lifestyle, in behavioral changes, affluence, and that also contributes to it. So these driving forces are putting pressure on 2 sides. One is pressure on the resources. We are extracting more and more resources, whether it's mineral resources, fossil fuel resources, metals, construction materials, biomass, industrial minerals, etc., water. All these are resources that we are consuming more and more to keep up with our growth. On the other side, the forces, the pressures are on emissions, pollutions, air pollution, water pollution, etc. And both these, on the supply side, on the user side, both sides we have impacts. We can see from the resource side, we are seeing the changes in landscape. We are digging up mines to extract coal and leave behind pollution. Similarly, we can see the hydrological changes, soil degradation, etc. on one side. The other side, we can see the impacts on climate change, acidification. We can see many species that are disappearing with time. Now, we're talking about resources on one side, the pressure on resources. What type of resources do we have today? We tend to believe we live in an infinite world. Our aspirations are infinite, but we are in a finite situation. So you can see all the water of the world, ocean water, river water, lake water, everything you put together, they will just be this size compared to the Earth size. All the air that we see in the atmosphere, that will be all represented in a small sphere there. That's what we have. And so far, we don't know any other planet where we can go and live. So we need to see in what way, in these finite resources that we have, we can manage and grow. We can fulfill the requirements of everybody. Now, unfortunately, as I've mentioned, one of the factors which is very important is the behavioral and lifestyle changes, the affluence, which is creating problems. If you look at Earth, Earth Overshoot Day was on the 1st of August. That means for this year quota, we have already used our quota for this year, and we are overdrawing. No bank would do that. You go to the bank, if you try to withdraw more money than what you have put in, no bank will give you that credit. Whereas we take it for granted. And this shows actually the different countries per person usage. For example, you have seen some of the developed countries, the use of the resources by February, they are already overdrawing it. Some countries are doing it by July, August. On the whole, we are doing it, if you take the whole population. Here you can see Vietnam. By the end of 21st December, they have used up. Even a country like Vietnam, they are short of resources for the last week of the year. Okay? If every country, for example, if we all had adapted, because many of us have the dream to achieve the same level of affluence, same level of comfort, same level of lifestyle as the US, Europe, etc. You can see Australia. If everybody lives like in Australia, we need more than 5 planets, but we just have one. In Asia, our model is Singapore. You can see where Singapore lies. Okay? Many of the European countries, those who are telling us today, they're doing great things to protect the environment. If we adapted their lifestyle, whether it is Germany, Switzerland, France, they all are talking about 3 planets or more. So obviously they cannot be our model. We need to find our own model. Okay? Even if we'll get some ideas from them, we need to find new ways of addressing the issues. So to show, earlier I showed you population is growing, economic growth is happening, but you can see environmental impact is also along with the economic growth today. Resource use is also along with the economic growth. So everything is in upward trend. If that is the case, we cannot sustain ourselves in the long run. So we need to do what is called decoupling. How do you make the separation between the way we grow, economic growth, and the way we consume our resources? We need to do a decoupling so that we are able to reduce our resource use for the same level of comfort, healthcare, and other aspects. Similarly, how do you detach economic growth from environmental impact? Now the question is it possible? But the same question could have been asked 250 years back when the Industrial Revolution took place. Nobody could imagine that one person could make 200 shirts a day. Those days people had to do it manually. So if you had talked about human productivity going up 250 times, nobody would believe that. So we need to look at the similar type of models now. Instead of following the Industrial Revolution, we need to have a second Industrial Revolution through which we'll have to look at not only human productivity, also resource productivity, as well as environmental resource management. Okay? So now I would like to talk a little bit about how we use resources today. Very often, we talk about plastic bags, refuse plastic bags on the road. Okay? You go to a shop, refuse plastic bags. Save your water. You can save water, let's say per day, 10 liters. If you save 10 liters of water or 220 liters of water per day, at the end of the year, you would have saved maybe a few thousand liters. So that's like the tip of the iceberg. When you see an iceberg, you only see about 1/6 of it. 5/6 of it is hidden somewhere. We don't see that. So how do we start looking at things in a different way? We're just looking at what we see, and we need to act on that, but what we don't see. How many of us know that every kg of rice that we consume, the food that we consume, how much of water goes into making it? How much of natural resources go into making it? How much of energy goes into making it? If we become conscious about that, you can see, for example, if you go for animal meat, it's equivalent to 1 kg is equivalent to driving 27 kilometers of car. Okay? So this is showing the scale of when you eat different types of food, how do we choose our food in a manner that we can reduce our water footprint. Similarly, we can see that was energy footprint. This is about water footprint. Every product, and I'm sure Dr. Thale is going to talk more about the life cycle analysis, and that is where you'll see how do you assess the quantity of water that goes in. The apple that we eat today, how much amount of water that has gone into it. You can see one whole apple is 70 liters of water. How many of us are aware of it? We are talking about symbolic gestures. So the time for the symbolic gesture is over now. We need to really go into more details to see what way we use things directly, what are the impacts, indirect impacts of our activity. So for that, we have to see, we talk about the 3 R's of waste management: reduce, reuse, recycle. We need to start looking at reduction part, which is more linked with our behavioral and lifestyle changes. Okay? When you reduce that, we are not only reducing the waste, what is going as waste, but we are also looking at upstream how much amount of savings we are making in terms of all types of resources, whether it's energy, water, raw material, etc. Okay? And the impact on the environment from that perspective. So overall, we'll be hearing from many of the speakers afterwards how actions can be taken specifically in the healthcare sector to manage energy, build hospitals in a different way, use water in different ways. I would just like to cover perhaps more in a strategic manner to achieve what we call, today we are talking about how to achieve water neutrality, energy neutrality, achieving zero energy, zero water, etc. So for that you need to have what I call an integrated approach to sustainability. What I would show in energy will be applicable also for water, will be applicable for raw material, etc. I just want to show it in a more graphical form. This is what we are consuming today in terms of energy and carbon emission. And you've seen that both energy consumption and carbon emissions are going exponentially with our needs. So if you need to curtail that, where do you need to start from? Is it just to change things? The first step I would say is to start with behavior and lifestyle. Okay? How do you adapt a lifestyle which is one planet lifestyle? We know that we have only one planet. How do you live in that one planet in harmony with the nature? And that itself is a change of mindset, because it's not all that easy. We need to look at it on a global perspective. That's why I wanted to start with the global perspective, because individually you may think, what can I contribute? I cannot contribute much. But believe me, every drop of water, if it's thought in the same manner, will not have a stream, will not have a river. So it's important that the drop of water also goes towards that same direction. So each of us can also go in that direction by first looking at behavior and lifestyle changes. The moment you have done that, you can see your resource requirement, energy requirement, carbon emissions have gone down at no cost. That's why I said I put a cost factors, because everything is judged today in terms of cost and benefits. Here you have benefits without any cost. So that requires mindset change, behavioral changes, lifestyle changes. But that's not all that easy, because, you know, habits don't go away so easily. As I say to my students very often, habit, H-A-B-I-T. You take out H, a bit remains. You take out a, bit remains. You take out B, it remains. So it's not all that easy. But you need to drill it into mind gradually how to bring about behavioral and lifestyle changes. Next comes, more important, whole system designing, integrated approach. We have a tendency to look at only one portion, and we specialize in that. All our activities all our education process, we are focusing only on certain aspects. We don't see the impact of that. We don't see what is required for that to happen. A hydrologist is looking at, somebody who's building a dam is only looking at how to build the dam, not looking at what is the upstream impact of that, what is the downstream, upstream pressure of that, and downstream impact of that. So how do you look at it from a whole systems approach? When I'm constructing a building, am I thinking out what is the resource required for that building? Can I build the same house with much less resources? Can I make sure that it can run with types of energy that can sustain forever? Otherwise, what type of assets we're building? All of us think about assets for our children. We try to leave assets for our children. The way we are behaving today, the lifestyle that we are maintaining today, all these assets will become liabilities. They will not remain assets. You may have a car, but there will not be any fuel to drive it. You can see what is being discussed today. In present context, everybody is talking about how the government should bring down the price of fuel. We're not looking at how to make changes. This is an opportunity for us to understand that what we are seeing is only the first light. If you continue further, there'll be things even much worse. Instead of looking for solutions, we are trying to fix it by measures like reducing the cost, so behavior will not change. We need to look at it in a different perspective. The moment you have done whole system design, you will see your requirements will be reducing even further. Now go a step further. Now, then we can look at efficiency. Just like we have seen, human productivity has gone up so many times. Can you have efficiency improvements? Can you have what we call a factor 4 achievement? Same resources, same services, but using 4 times less resources. Same services using 10 times less resources, achieving a factor 10. The moment you change from, I see the lamps are incandescent lamps here. If you change those incandescent lamps to LED today, that's a factor of 10 improvement. You get the same level of lighting, but you'll be using 10 times less resources. You'll get the same energy services. How do you achieve those? Already technology is there. The question is how to bring it in. That will require some investments, but those investments will be paid back in a reasonable time frame. And then all these measures that I talked about, they're on the demand side, that reduce part. How can you reduce through behavioral changes? How to look at whole system designing process? How to look at energy efficient technologies? Then we can look at renewable energies and other forms, alternatives. But you can see, in many cases, our focus is mainly on renewable energy. We haven't changed all these things. So we need to start in a different manner because we are in a country, we are in a continent where there is a demand. The population is growing. There is a shortage of resources. There is a shortage of houses. There is a shortage of roads. There is a shortage of infrastructure. How can you think about having a different lifestyle? Okay? Instead of building highways, can you think about more public transport? That will make a big difference. The history has shown us the more you make the roads wide, more vehicles will be there on the road. And that's not going to help us in the future. Okay? Just like I've shown you for energy, I can do the same thing for water. If you need to look at it, people talk about do rainwater harvesting is going to solve. Bring in the behavioral lifestyle changes. You go to the forest, you can manage your water requirement with a bottle of water for the whole day because you don't have any other sources. Just because we have piped water today, we don't bother about it. Okay? We open the tap to brush our teeth, 5 liters of water is gone, and that much amount of water you have to have the infrastructure to take it as waste, manage it afterwards. If you can do it with 1/10 of that, just like I talked about energy efficiency, achieving factor 4, factor 10, we could do the same thing from there, from behavioral lifestyle changes. Then we can bring in, of course, the water consumption. How do you reduce from whole system designing? Somebody who is making water supply system does not necessarily is responsible for wastewater disposal. If you bring them together, you'll find new ways to do it. Instead of trying to change the water pipeline in the city every 10 years or 15 years because the demand is growing, can we provide people with more efficient taps and recover the money within much shorter period so that there is no wastage? So even the thinking process at the higher level needs to come in, but at the individual level also we can adopt it in a more efficient manner if you look at the whole system design. Can I manage with what we have? We think about the planet, but can I do it at my home level? Can I do it in my hospital level? Can I do it in my office level, etc.? And then, of course, it follows the same pattern as looking at water efficient technology that I talked about. Then we can think about how to reuse. You will have a very good example to see how Aravind Eye Care takes care of the water by water treatment and reuse. Okay? But you can see that comes much later. If you haven't thought about all these things, we'll have a much bigger infrastructure, and the cost will be much more to treat the water and reuse it again. So why start with first thing, creating that need? If you can avoid that need, we don't need to have such a big infrastructure. We can do it. But people take pride in saying, I have such a big water treatment facility, without looking at how can you reduce it in the first place. And of course, then comes other means like rainwater harvesting, for example. Okay? I could go on in the same manner for other cases. I know I have limited time, and I know that others are going to speak a lot about it. I have a few slides. I may skip them because there won't be enough time to cover all of them in details. So I'm sure Dr. Tell is going to talk about the Lancet report. Okay? Healthcare sector is an important sector because it is becoming, first thing, all these that we talked about, resource use and the environmental impacts that it's having, they have impact on the healthcare. So healthcare sector can take care of it in two ways. In one way, how do you set the example for others to follow? The other way is to how to create awareness with the people. And the third one is to show what way things can change. Okay? You can be the seeds of change for others to follow because people would tend to, people respect you in the society. How can you make that change? By taking the lead and showing them that things can be done in a different manner. So Lancet report said, the indirect effects of climate change on water, food security, and extreme climatic events are likely to have the biggest effect on global health. So it showed what the problem was, what the issues were. But it didn't stop there. The same report also said, the tackling climate change could be the greatest global health opportunity for the 21st century. So what is a challenge can become an opportunity. We need to look at it from that perspective. Unfortunately, we're stuck with challenges. I mentioned to you about oil price hike today. Everybody's shouting about it. We're not looking at that is an opportunity for us to make the changes, adapt new ways of doing things. We are stuck with the old way of thinking. We are not innovating. And I would like to again congratulate Aravind iCare for the lead that they've taken in many areas. Their main focus has been eyesight, but they've also shown others how you can do the same thing in many ways. How can you provide the same services using 10 times, 15 times, 20 times less resources? And that should be a good example for others to follow. Environmentalists, I will not go into the details. You can see human health impacts. It starts right from the beginning when the mother is pregnant, goes through a child is born, and then goes further when you start moving. At each stage, we are creating an environment where it's becoming impossible for people to live because we are creating diseases which were not there in the past through our human activities. It goes through the school level, okay, when you become adults, so you can see all levels. We are exposed to things today without knowing it. So I talked about many things that we only judge on the basis of the tip of the iceberg. We need to go deeper and see where is the source, what are the challenges that we have. If we understand that, okay, again, I won't go into the details of this, just to show that there can be levels. I talked about thinking global, but acting local. Globally, we see what the challenges. I told you that resources are being used in a very irresponsible manner, and population is growing. We need to provide in an equitable manner. All this is possible if you think about the global ecosystem, but start acting, keeping people at the heart of the things. But interestingly, you know, we talk about people. We think we are the center of the universe. If you take the world as a clock, 24 hours clock, human beings came in only in the last hours, last minutes of this 24 hours. But we consider ourselves to be supreme. We behave as if no other species live on this earth. We don't care about them. And without those species, our survival is at stake. Okay? They help us in some manner. Nature has a natural cycle to sustain itself, to recreate. But we are not giving that opportunity for nature. As I showed you, we have already exceeded our footprint for this year by the month of August. That means we have shortage of about 4 months. Next year it will become 4.5 months, and so on and so forth. We come to a point that we have a full deficit. And in the process, we are destroying many of the species who are helping us to sustain ourselves. So let's bring back how to work with the people first, how to bring it in an equitable manner, how to give them that importance so that people can act through lifestyle changes, building the community in a different manner, changing the local economy. We don't have to go and get things far away for our requirements. Today we are talking about food within a radius of 15 kilometers or 50 kilometers. We don't have to go and look for your food which is coming 5,000 kilometers away. So the food miles is becoming important, and that will reduce our carbon footprints because food miles is linked with the transportation. If you use the local food which is grown locally, then the energy requirement, the natural resource requirement will be much less compared to if it's bought somewhere else. So how do you bring in that local economy more and more in phase? We can think global, but we still have to have that local economy. If you think everything is one world and we start moving from one to another, that's where our problem is today. We don't see the limitations of our resources, and we think that we can borrow from somewhere else. If you don't have it, I'll take it from somewhere else. But what we take from somewhere else, what we dump somewhere else, they're both on the same earth. So at one point of time, we'll see resources are not there, and everything is converted into waste. Talked about built environment, natural environment, and then gradually you can see you can change the ecosystem in a different way. I will skip some of the slides because I'm sure Dr. Thel is going to talk about them more in detail. I was not aware of what is going to be talked about, but I've spoken to her. So I'll skip some of the things. But the healthcare sector has been already thinking about it. This is a report of WHO, which started thinking about it more than 10 years back. They came up with a report of saying how to create a climate-friendly hospital. And they looked at certain aspects. How do you create a climate? This is downloadable. You can download this from the website. They looked at how to improve the efficiency, how to design a building differently, how to look at alternate energy generation, think transportation in different ways. We'll see again example of what Aravind has been doing in transportation. Interestingly, many things they have been doing in the past without knowing about environmental sustainability, because it's the thinking process. What is economically viable is automatically environmentally sustainable. that is also good for the people. So in 80% of the cases, you'll find they go in the same direction. There's no contradiction between equity, economy, and environment. And that's why many businesses are switching over to what we call the triple bottom line, or the 3 Ps, for people, for the planet, and for profit. They go together. There's no contradiction between them. So how do you achieve that? Through all these cases, whether it's food, water, waste, etc. Okay. So all these cases, that's why the program has been done in such a manner that we'll have experts who will be talking about, touching upon each of these ideas more in detail. I had a full case of, for example, I was trying to look for information in India. I could not find any. So to start with, we need to have a base case to know where we stand today. So each of you in your own healthcare sector, try to find out information. Okay? I could find only for NHS, the UK National Health Service. They have done for the whole NHS what type of emissions that they have. Their carbon footprint, they have tried to find out. 17% is coming from transportation, 24% comes from building energy use, and surprisingly, 59% comes from procurement. Again, as I said, it's like the tip of the iceberg. We are acting on buildings, we are working on transportation, but we don't see in procurement there can be the huge potential for improvement. And again, we'll be hearing more later from sessions where people will be talking more about how can you act differently in procurement to reduce your carbon footprint. They have a roadmap. When they started doing this in 2007, they put a roadmap how by 2050, this is the pathway they're following, how can they bring it down? The target was here. They could find out with different measures, how do you bring it down here? Each of these you can, again, identify with the measures that I talked about. It's linked with water efficiency, it links with the building, etc. They did a very good audit to find out where are the major ones. They address those first. So fix your priorities. If you fix your priority that we will not take plastic bags, you will not go very far. We need to have more ambitious priorities. Look at where the maximum damage is happening and where the maximum resources are being wasted. So you can see over the years, this is example of over a few years, this is 2011 if I'm not mistaken, they have seen, starting with their baseline, they have managed to bring it down here. At the same time, you can see this part is showing how much has been the growth in their activities. In spite of the growth in their activities, they're able to bring down the carbon footprint from 2007 to 2015, that's 8 years' time. They brought it down by 11%. That includes the growth factor. If you take out the growth factor, the savings are much greater. So you need to put some targets and try to follow this. Okay? Health sector is already doing some changes. For example, they have identified, this is the case of nephrology, they have identified very specific cases, for example, renal units. There are areas, there are several improvements possible in terms of procurement, waste disposal, energy, water, remote disease management, etc. They have quantified, if these were applied in the whole world, in NHS on the whole, you could save about 470 million liters of water. That's not a small amount. So as I said, all the drops, if you add them up, they will create big resources savings. Similarly, monetary savings. It's not just about resources, it's also money. They go hand in hand. And of course, the CO2 emission reductions. There are many other examples. Again, I will skip them. You'll have the time to read through this. They have all find out different hospitals in the UK. They have already practiced all these things. And each of them says the same story. We have done it. We have saved money. It's not just for the environment. It's not just for the resources. We're also saving money. So they are all inclusive. So, okay, I'll skip this because I know that I think Dr. Thiel is going to talk about more of this. Okay? And of course, there are working groups. If you want to know more details, this website will give you a lot more information about what is already happening in ophthalmology field itself. Okay? One example I just wanted to give you, you can see the small change. You have all heard about Aravind Eye Hospital's contribution in terms of the lens. Similarly, a small change. Traditionally, people use lamps which cost more than $500. Today, we have come up with a lamp which costs less than $10. And that works with solar energy, which means even in the remotest villages, a healthcare professional will be able to access it, afford it, and people can afford the services afterwards. So this is a small change where you minimize your resources, the cost comes down, and you're providing cheaper healthcare services to many people. Right. There are many other examples. I don't have the time to go through it. I'll also skip over it. This is what I mentioned earlier, the leadership. Leadership is very important. And to do the leadership, we need to communicate and convince to adopt changes. So Dr. Venkatesh rightly pointed out, we need to take this from the small scale, how to expand it so that more people know about it. You need to have more converts coming onto in the field. Okay? So just keeping it at this level is not enough. From 50 people, how do you bring it to 5,000 people or 50,000 people? Then you'll see the changes. For that, of course, how do you communicate the message? Okay? First thing, put people and health first. Everything else will fall in line. We have seen if people and health are taken care of, economy will do well. Environmental also is going to do well. How do you bring in that? Using trusted voices. So for me, Aravind is a trusted voice. Similarly, you can have many other trusted voices through whom you can communicate this in a more effective manner. How do you appeal to the community values and local impacts? You may talk global, but how do you do it at the community level so that people can see the impact, they can see the change, and they will start changing themselves because they're inspired by it. Last but not least, stay positive. We need to stay positive. The challenges are there. How do you convert into opportunities? We should not discourage the future generation that they have a doomed future. It can change. We can be the agents of change. We can be the seeds of change. We need to start from there and empower the change. I'd like to stop my presentation with a slide with a Chinese proverb which says, when the winds of change blow, some people build walls and others build windmills. Decide what you want to do. Thank you very much.